Good evening, friends and colleagues from here in Ireland, our wonderful hosts, and from all around the world. My name is Sproul. I'm the Senior Strategy and Development Officer at the Uganda National Academy of Sciences, where I've been for the past 8 years. What originally was supposed to be a 2-month volunteer stint turned into 8 years, and Uganda also turned into my new home. There I've been able to establish a family, but also a wonderful circle of friends and comrades who in part I represent today. You may ask, why is this biracial kid who has a Scottish last name, Sproul, doing representing the Uganda National Academy of Sciences? And in part it's because of all of the things that have sort of shaped who I am, the experiences that I've had, and in part reflect why this report is so important to me. I've been a part of a team that have written 5 of these different types of reports, but in particular this one stands very close to my heart. 5 years ago, my first son was born, but he was born prematurely at 32 weeks. Within the first day, he was taken to the ICU and he was intubated. So he's put on a ventilator. This already might be quite terrifying for a parent, let alone dealing with this in a country that you were not born into, and coming from a space where you're very privileged. In Canada, everything would have been taken care of for you. But in Uganda, I had to be able to understand and realize the nature of my privilege and also the nature of what it's like for all of my comrades and colleagues. Oftentimes it's kind of easy to be able to talk about these things in the abstract, but for me it was very real. I was terrified for weeks, and the bills began to start accumulating. 2 weeks later, my son, for whatever reasons, decided to pull out the tube himself. And for whatever reasons, he breathed on his own. Since that point in time, we've struggled with different things. We've realized that he actually has a neurological disorder, and we've realized the complex needs that he'll need for the rest of his life. But nonetheless, this experience has taught me a great deal of humility and a great deal of the power and value of what it means to be, of your relationships, and how important it is to be able to cultivate and treasure those relationships, because all of my comrades and colleagues were there with me the entire way. So on that note, I'd like to introduce some wonderful people to you today. This will not be a normal panel session. In fact, this will be a continuation of what I've just started. A chance to speak about the stories and the experiences that have shaped not only why we made this report, but why the report's contents are what they are. So first off, let me introduce to you Mr. Bruce Compton. He is the Senior Director of Global Health at the Catholic Health Association of the United States of America. You'll be joining us up here. Katthyana Aparicio Reyes, she's from Ecuador, and she's also the Program Officer at the Quality of Care Unit at the World Health Organization in Geneva. I'll introduce Soledad Quiroz Valenzuela. She's the Deputy Director of Knowledge Management at the Universidad Central de Chile. Each of these wonderful people have been part of this long-term, 1-year process of putting this report together. And so we'll speak a little bit also to the process of how we developed this, but also to the stories and experiences that they had going through it. But perhaps, if it wasn't already clear, I do need to make sure I recognize my boss. That's always a good step. Christian Acemah, the Executive Secretary of the Uganda National Academy of Sciences, who is co-moderating with me this evening. So briefly, I think what we can start off with is, well, how did this book come to be? So I'll actually ask that to Bruce. If you can speak a bit to the study process and impart some of its contents in terms of what it's trying to say and why it should be so important for us.
Thanks, Sydney. Well, you heard from Shiley about AGHP, Advocacy for Global Health Partnerships. CHA has been a part of advocacy for global health partnerships from the beginning, and I'm the Senior Director for the Catholic Health Association of the United States. Shiley went through the background, but I would say, what I'd like to say is that to acknowledge that the Brochet Declaration, which was about short-term engagements, has been signed by the Irish, endorsed by the Irish Global Health Network and Esther Ireland. And those principles for short-term engagements are important. And any of you that do short-term engagements in global health, I'd encourage you to look at those. That journey that Shiley talked about, where AGHP started at an event, a CUGH event in 2017, really led us to think about what does it mean to be in partnership, and how do we change these short-term engagements to be more ethical, equitable, and so forth. As Shiley talked about, we got a grant and met in the Brochet Foundation in Geneva in 2022, where we pivoted to say this isn't only a problem in short-term engagements, it's truly a problem in many global health partnerships, and we all need to be reflecting on the ethic and equity and the realities of our global health partnerships, and how can we continue to improve them. Not just the metrics of the outcomes that we're looking for, but what about those communities in which we're often working? And so, since Uganda National Academy of Sciences stood up in 2022 and said we would be willing to lead AGHP and this conversation as we pivot to global health partnerships, it became very natural over the 2 years. And I guess after we had a meeting, a side event at the WHO last year that was standing room only at Gavi, to talk about global health partnerships, and we heard how some of those big partners and funders were sort of like hearing for the first time that there was inequity in partnerships. We had a funder say, oh, I've never really thought about all the paperwork we make you fill out for getting this grant that you get. It was a little embarrassing to hear that, but at that point, I think it encouraged all of us, and AGHP, which Christian is also a part of, commissioned the Uganda National Academy of Sciences to take a look at this and say, what are some guiding principles that could really lead us into thinking about global health partnerships differently? And that has led to this Enacting an Ethic, Care and Responsibility in Global Health Partnerships, which was a consensus study. The process, as Christian said, has been over a year. Christian told us several times along the way, don't panic, just embrace the process. I can tell you I was panicking until about 2 weeks ago when this thing was finalized. Katthyana said yesterday, enjoy the process. I don't know, it was hard to enjoy at some points along the way as well. But I was asked also to give a few points about what was our statement of task. And if I can get my notes to come up, I'll try and do that. So we really wanted to develop a paper that understanding that this transformation of partnerships that we're really looking to think about depends on fostering humanized interactions characterized by solidarity and mutual respect. And so we wanted to identify current practices that are entrenched within global health that hinder our progress in having an ethical, equitable, effective partnerships. We wanted to develop an evidence-informed approach about relational learning that could help enhance global health equity in those partnerships by transforming relationships among actors at all levels. We wanted to identify shifts in everyday relational attitudes and practices that can empower those eager to address inequities, even in with these complex realities of global health. And reimagine partnerships with equity at the center as a moral and strategic necessity to unlock the potential for all of the diverse expertise that we've heard about today and around the world that exists and wants to do this, to really tackle these health challenges in a way that is ethical, equitable, effective. And identify how equitable partnerships are crucial for ensuring human dignity, upholding the right of health, and fostering cooperation. And then we wanted to take all that and develop principles of equity into actionable strategies that reflect the interconnectedness of our world, of each of us, of all the people we've heard and talked about today, and our shared aspirations of our global community. A small statement of task, and you can probably understand why I was uneasy and not able to enjoy the process at several times along the way. But it led us to several conclusions. The complexities of global health funding are extremely complex, and the landscape is characterized by diverse partners, competing priorities, and inherent power imbalances. We found out that the pursuit of harmonization, while well-intended, doesn't always work, and it sometimes can inadvertently perpetuate inequities and hinder long-term systemic change. We really wanted to think about how we can evolve the thought about capacity, and capacity should move beyond just a deficit-based approach, recognizing, as Christian said earlier, the knowledge, agency, and resilience of communities around the world, and prioritizing their self-determined agendas. And of course, all of this in pursuit of, in the pursuit of equity, we require acknowledging humanity's interconnectedness, openness, and curiosity. They're all essential. And then finally, humility is something that we really feel that is important in getting to a point where we can enact these kind of relationships. And so that led to several recommendations around funding and incentives, promoting transparency and open dialogue about the financial incentives. It led to embracing flexibility when it comes to this harmonization and the contextual understanding while fostering genuine collaboration. I think I already said that this capacity, we need to move from capacity building to capacity strengthening, emphasizing local ownership and facilitating multi-directional knowledge exchange, and then embracing those diverse perspectives. And I think this is a tough one for all of us, and we've seen some people leave AGHP throughout the years, and I think some of it's because they have a tough time with this one. How do we manage our own defensiveness? How do we foster a culture of openness, humility, and emotional intelligence that encourage us to be power sharing, create clear communication channels, which Nadine talked about, so that we can have constructive feedback? And we believe that we have to be humble. And we have to use humility if we're truly going to have transformational partnerships. David talked about AGHP starting in America and now being headquartered at the Secretariat in UNAS in Uganda. I think we all need to try and figure out how do we make the moves to really allow our actions and our words to match. And we were saying we needed to do that, and it is now being housed at the Uganda National Academy of Sciences. So that's probably more than you wanted, Sydney, but it's It's what got us here, and it's amazing to have this. And AGHP will now take this and our previous things to really turn it into an agenda for how do we continue to gather others to live by these principles and the ones that to develop a set of principles for global health partnerships.
No, that was really excellent, Bruce. You can give him a hand, please. And perhaps to just take on that note, I think it's important for us to be able to reflect very quickly, just for like 10 seconds. When was the last time you felt uncomfortable? And to consider what discomfort has done to you in terms of then how you respond and engage with other people. So just take 10 seconds and think about the last time you're uncomfortable with someone else, and how that affected potentially the way in which you related to them, the way in which you spoke to them, the way in which you listened and heard their words. That's just something to think about, in part because I'm going to ask Soledad to give us a bit of a story in terms of how she became part of this committee and also her experience with it. When I first actually tried to get a meeting with Soledad and we met, one of the first things she said was, "This problem seems impossible." She said, it feels impossible. It feels so big. I don't know how to deal with it. But she still said yes. So, Soledad, can you give us a bit more of the detail in terms of not only why you joined this committee and why it's important to you, but also what kept you in it?
Thank you, Sydney. Hello, everybody. I am uncomfortable now. It's not easy for me to take the microphone and speak to a bunch of people in English. It's not my native language. But that's when I have found out that I learn the most. When I make mistakes in my exams, when I said something to my daughter that I shouldn't have, and I suddenly noticed. Those are the things that I kept in my mind the most, and I find a way to fix it, or not to fix it, but to forgive myself and do better next time. So I had a bunch of opportunities before in my life that I said no to because I was scared. And Sydney found me in a year that I started to say yes to the things that got me scared and got me nervous. And it was such a wonderful experience. It is the most wonderful experience I've had in my life, I think, other than having my daughter. I have had the opportunity to meet wonderful people that kept me believing that there's still people who wants to make the world better. We have heard here about all the crises, health crisis, peace crisis, people leaving their homes because of several reasons. And here it is, a bunch of almost 10 people trying to figure out how to make global partnerships better. So it was an impossible task, but I knew that anything we could give, it was going to be something that will make people think, that will make people uncomfortable, and so they will make it stop for a second and say, maybe I can do it better. Maybe I can save one more life. Maybe I can tweak and give in to this odd request to make this partnership work, because that's more important than to fill out properly this form. So being uncomfortable and learning, it's something I enjoy, and that's one of the reasons I started and I kept going. I also felt it was my responsibility again, thinking back of why someone from Uganda is calling me, from the Academy of Sciences is calling me. I'm not a member of the Academy of Sciences in my country. Why are they calling me? I'm from Chile, you know, down there. Nobody really knows where we are, what we eat, where we live. Nobody really cares much except for Chileans and Peruvians and Argentinians, which are just next to us. So why is he calling me? That's another impossible question to answer. It's just by chance. But I am here and I have the responsibility because I can speak English. Not many people I could pass this challenge to could speak English as good as I can. So probably they will not be able to give their thoughts to this group of people in a way that it was useful. So I had to, you know, try to think hard what sort of things I should say to this group that can actually represent people from Latin America who cannot speak English. I'm from a country, Chile is a high-income country. We do not receive much money for health issues. We actually don't have so many health issues. We were one of the countries with highest rate of vaccine for COVID. Up to this date, my parents have contracted COVID twice, not in Chile, in the United States, when they traveled to visit my uncle. Yeah, I don't have to worry so much about COVID back in Chile. So what can I say as a Chilean, as a scientist, as an academic, as someone who wants, and once after finishing her PhD decided she didn't want to pursue an academic career, but to go to policy, and change a whole line of career. How can I make this science and this knowledge and this experience to help people in a different field, in a different country, in a different space to make things work better? And so that was a big challenge for me, but I think I got to enjoy the process and learn a lot of my colleagues. And one other thing that I learned from my days in public policy that I bring here is not about money. Sorry, it's not. It's just definitely not about money. When I was trying to understand why in Chile we couldn't get science to give more to society, we will always point to the very, very, very low investment in science we had. And I did a list. I called all the scientists in Chile. I called them to this meeting, 300 scientists in 9 different cities in my country, pull up this big list of why science is not working in Chile. I presented that in a conference in the United States, and a Korean guy came and said, well, that's interesting. You have the same concerns that I have in my country. Well, that's not possible, I said. You have one of the highest investment in science in the world. We have one of the lowest. It is not possible that your problems are the same that my problems. He said, well, it is possible. It is, because this one here, this one here, this one here, this one here, this one here are all the same problems that we have. So my conclusion was, it's not about money. It's about what people can do, what we can understand of what is the other context, what is the other person's position, to understand what is to be in other people's shoes, that will make partnership work. So with that, I think I'll leave it to you. Thank you.
So, in many ways, some things to take away is the extent or the conditions that set us up to learn. And in part, yes, some degree, we don't want to make you too uncomfortable, but some degree of discomfort is a reflection and an opportunity for us to reconsider sometimes the things or assumptions that we've made about a particular issue. And I think that, in part, that's what you're trying to point out, Soledad, is that there's often an opportunity waiting for us if only we're able to overcome that initial discomfort, to be able to find something new. And in part, sometimes, though, the conditions that we're operating within can be quite complex. And so in part, that's where I'll get to Katthyana. Because when you work for the World Health Organization, there is a lot of baggage, to say the least. You have a lot of pressure, in part because it's the World Health Organization. One of the things that I sort of became acclimated to when I was in Uganda was the extent to which everyone kept referring to the WHO guidelines. And when I was in Canada, I was like, I have never heard of the WHO guidelines. Why is that? But at the same time, I've also learned over time of the complexities and challenges within the WHO itself. That because you're the WHO, you can walk with a certain gravitas, and sometimes, unfortunately, a kind of arrogance. That can potentially then limit, again, your discomfort and your willingness to learn. So in part, Katthyana, please, tell us, you've been in the WHO for a while. How did you navigate this? How did you find value in this engagement, given all the things that you've experienced and learned in your time at the WHO?
Wow. Thank you very much, Sydney, and good evening, everyone. And I hope you are not tired enough not to listen what I'm going to say, and I try to be very brief. For me, it's a privilege to work for WHO, to be honest. I've been working in WHO for the past 17 years, and I have to say that it's a privilege, but I had some frustration moments in which I would have had the opportunity to do more. But it's a big system, it's a big machine, WHO. And at my level, I don't have the power of big people. So I am here supporting this group, and I've been here supporting this group on my own capacity of someone that has been working on partnerships, supporting our own program on twinning partnerships for improvement for the past 10 years, and bringing the learnings from our partners, partnership implementation, bringing the experiences that we had, experiences of successes, but also failings. And when I would like to talk about the failings that were more about, we failed to really build relationships. And this is what I want to bring, and this is what maybe I brought to this group, because it was such an experience that when you fail to build a relationship in a partnership, you cannot achieve the outcomes you wanted, or in the way that you wanted to achieve. And I think for me this has been a big lesson, is that building a relationship is a process. And this is probably why I am advising, or maybe just saying that we really need to enjoy the process. In any relationship, when you are with your partner, with any member of your family, it's a process to build a relationship. and we need to embrace that. And it's not perfect, and it's not perfect because we are human beings, and human beings are complex. And that's why our systems are complex, because our systems are made of people. And this makes even more complex because we need to deal with the complexity of each human being. So everything is connected, and we talked here, we talked about interconnectedness. And everything is interconnected. And as a human beings, we are interconnected to each other. And these experiences of interconnectedness is building the relationships that ultimately will achieve the outcomes of the partnerships. So I really appreciate the invitation to be part of this group, to this steering committee, and start to develop this document in a different way. We started to think differently, to tackle things that maybe in normal ways we don't. Who is teaching you about relationships? Nobody. It's the school of life. Yeah, it's the life school. Because when we go to the school, nobody is teaching us how to relate to each other. This is something that we learn. And to be exposed to many kind of partnerships in so many countries really was a big learning for me, that we need to acknowledge those diversities everywhere, what they can bring. Everybody can bring something different, different skills, and we complement each other, and this has been so beautiful. So I am really passionate about the partnership work, because I have been able to see what we can achieve together. A person alone can achieve little, but when we are together on the same boat, we really can navigate and go far. So this is what this is my experience, and what I can share with you all. And Nadine mentioned something about listening. This is something that we also need to cultivate. And I would say, listen not only with your ears, but with your heart. And do the things the same with your heart. And I think that this is how we can enjoy the process.
Thank you so much, Katthyana. So I'm not going to keep you from this reception, but I'll now call upon Dr. O'Flynn and Christian for, I think, some just closing remarks, and then we'll be on our way. But otherwise, again, if these stories haven't already kind of got you interested, this is just the beginning.
Excellent. Thank you very much, Sydney and committee members. We actually have, yes, Shiley and David were also members of this expert committee. As you'll see, we brought copies of this report for all of you with love from Uganda. Let's say three things. Number one, it is not by accident that we are launching this report in this country, in Ireland. Not ours. It will be launched now at the end of this month, but here in Ireland. And it was an easy sell to the board, because we said, guess what? We've always tried to go to Geneva, to London, to what? Your so-called typical places where you do these kinds of things, but it was an easy sell to say Ireland, because you were also colonized like us. That's not a laughing matter. It is a point of what we share very deeply beneath the skin. So that is one. And really, this is just so moving that things that we started, that we even discussed last year, have come up in this report. Second thing, When we talk about these power dynamics, it's not an abstract thing. Even on our committee, we made sure there was a power imbalance. The majority of our experts came from the countries that, as you hear, you've heard, are called Global South countries. And they spoke a lot, and they made us very proud when they spoke. That was part of the discomfort on our very committee. So it's not like we were sitting in a castle saying we are perfect. No, we had to work through the messiness of our own relationships on that committee. In many ways, we are still working through that messiness. It never ends. It's just the beginning. And so those power imbalances, if you do not start somewhere, you will always keep talking about them. As far as we are concerned, we have started in Ireland and we are never going to stop until they are done. So there we are. The third thing, you'll ask yourselves, why is it enacting an ethic of care and responsibility? The care part, you probably can understand easily. The responsibility part, that is a values-laden word. And so I invite you to first take that value proposition out, the values out, or the morality out that many times we talk about, original sin and so on, as I asked you about hypocrisy in the morning. Who is a sinner? That's not what we're talking about. We're talking about we recognize where we have come from, the kinds of damage we have done to each other in the name of global health partnerships. You all know the wealthy, powerful global health partnerships. They are not here. There is a reason. We do not matter to them. So we need to matter to each other. That is the only way we overcome that kind of situation. Because before you know where we are mattering to each other. The meaning will come up and we will just grow in numbers and grow in this thing we call fostering humanity. And it is not about blaming. It's not about saying, you've done us bad, you white people, even though you have. It's not about that. It's not about telling some of our leaders that they've embezzled money that has led to deaths. It isn't about it. You recognize it. Do not ignore it. Recognize it, but make sure, against all odds, that you move forward prospectively together. That is the responsibility we are talking about. It is the ability to respond and not stay in a reactive space of we are begging, we are clamoring, we need our voice heard, we need this. Who is going to get your voice heard unless you hear it yourself and amongst each other? The time for begging, those who do not want to listen to us, has gone. So now it's an invitation for us to move together. This report is a beginning of that invitation. So it's a real privilege and honor for us to launch that report here in a country that knows very well many of the experiences we discuss around colonialism, past injustices, and the need to move forward whole. So it's my honor to invite here Eric O'Flynn, fellow IGHN board member, to finish this ceremony. And after that, I think I'm not speaking out of turn by saying the reception is only for hypocrites.
Now, thanks everybody. It's quite a challenge to speak at 6:05 at a conference, but it's a much greater challenge to try to follow Christian in any speaking engagement. But I'll do my best, and I'll be brief, which might be the best thing I can do. So my name is, as you've heard, is Eric O'Flynn. I am on the board of the Irish Global Health Network. I'm also I work in the RCSI Institute of Global Surgery, so we're really delighted to have you all here in RCSI today. I've been given the great honor to launch this important report, and I'd like to start by congratulating those on the stage, but indeed everybody that has been involved in the creation of this report. And I think it's wonderful that the HSE Global Health, Esther Alliance Ireland, and the Irish Global Health Network have all played a part to different degrees in producing this. So that's fantastic. I presume the reason I've been asked to launch this report is our experience of partnerships. Everything we do in the Institute of Global Surgery is around partnerships, most of which are long-term and, a decade, 15 years, 18 years more, and ongoing. And we'd see many more decades into the future. We believe that partnerships are the only way to go. They're the only way. And I would say long-term partnerships are the only way to go. They're the only way that really impactful change can be made by high-income country partners. Ultimately, end of the day, our low-resource setting partners are the people who are doing the work, who are on the ground. What can we do? We can partner with them. We can travel the road together with them. So partnerships, they're here, they're core. We've been working out for a long time. I think we've done some things right. I'm sure we've done very many things wrong. And I'm sure we can do what we do better. Just a quick word on what it is, what it is we partner on. Surgical training, anesthesiology training, surgical simulation, all kinds of surgical workforce research, and recently an awful lot of global e-learning projects as well. So I think we in the Institute of Global Surgery, everyone in the room, we need to think critically about what we do. We need to think critically about how we do it. And I think that's why this report is really timely and really important. It's a challenge. It's a provocation in the best sense of the word. I think it's fair to say. And just a few reflections from my own point of view as to what I felt challenged by in a positive way. The report talks about the inescapability of power imbalances and the complexity of partnerships. It's there. It's not a problem that will be solved. It's something to be acknowledged and to be continually addressed. Those power imbalances, particularly related to funding. Absolutely. Something I hadn't necessarily thought about much. Harmonization is a challenge. Well, I suppose we tend to think standardization, harmonization across different projects, across different countries leads to quality improvement. There's some benefit there, undoubtedly. But thinking about it as a problem from the low resource setting partners' perspective, honestly, I hadn't really thought about that. In every presentation I give, I talk about our capacity building partnerships, capacity building. It's just one of those phrases that trips off the tongue, and maybe there's some merit in it, but this report challenges that concept. And I think I won't go into it, it's 6:10, but that was an interesting challenge to me. And finally, the call for humility. I don't know about you guys, but on Friday afternoons, I think I'm saving the world. On Monday mornings, I think I don't know why, we're making no difference whatsoever. So I vary wildly between, overconfidence and, complete despair. But I think humility is an important thing to say. So, as you can see, the hard copies of the report are being distributed. I believe it's not quite available online at the moment, but will be shortly, as I understand. Partnerships are not going anywhere. We need to get better at what we do. I think this report will challenge us to do so. And I'll just finish up with a quote from Henry Ford, not normally quoted, I suppose, at global health conferences. Coming together is a beginning. Keeping together is progress. Working together is success. Thank you all very much. Delighted to see this report launched.
You're supposed to.
Am I? Okay. In that case, I don't have a bottle of champagne to hit off the bow of the ship, but it's launched.
Kara, are you saying something about the reception? We do have a reception for hypocrites.
The bar is that way. The bar is open.